Well, hey guys, my name is Jim Merle, and I like to call myself the Transplant Helper. I've been blessed about 43 months ago to have a heart transplant, and since that time I've experienced an exceptional recovery. The doctors have told me time and time again that basically they believe I've had about the best recovery they've seen in 25 years. Now, certainly I give God the glory for all of that, but I also like to think that the reason my recovery has been so well is because I've taken a lot of time to try to manage my own care. And so because of that, I've spent about the last 43 plus months spending not only a lot of time dealing with my own life, but trying to assist the lives of other transplant patients. I spent a lot of time sitting down in hospital rooms, talking, counseling with, discussing, and trying to find out about the lives of other transplant patients, not only to help myself, but also to help them. And so because of that, someone asked me one day, Jim, why don't you take time and record or put on video the things that you've told us, the suggestions, the ideas, the tips, the tools that you've given us to try to help us to survive our transplant just a little better. And so I decided to do that, and it's going to take quite a while to do so. But I want to share with you, beginning on this episode and several more, the things that I generally tell people that I do in my life that help my day-to-day life to be better. Now, I want to say in the onset, I'm not a medical doctor, and I'll say that in every episode. I'm not a medical doctor. I have no medical training, so nothing that I tell you should be taken in any way as medical advice. I'm simply a person who likes to live life, and I want to live it the easiest and best way that I can. And so everything that I tell you, just say, well, this is not medical advice. This is only one man's opinion. This is only what one man thinks. And so the way I like to explain that is very simply to say this: don't quote me from your notes. And so the things that you remember, maybe that you jot down on a notepad, don't quote me from that. You've got to adapt it to live out your life. Now, let me point out a few things we're going to be discussing in the coming weeks and months as we make these videos. We're going to talk about things such as dealing with transplant as far as rejection. No doubt in my mind that when it comes to transplants themselves, hearts, lungs, livers, kidneys, whatever the organ is, rejection is a fear that is in the mind of every one of those people. No one wants to have to deal with rejection, but the truth is it is an honest fear and an honest danger in all of our lives. And rejection comes in many forms. One of the very mild rejection of an R1, as it's referred to, which generally speaking is maybe just a little bit of a medication adjustment. You move on and things are fine. Up to an R3, where someone is hospitalized. It's a life or death situation. The doctor's in a panic and a tizzy, as we say, trying to save their lives. Rejection is something that must be dealt with and must be monitored. We're going to talk about rejection on several weeks and try to find out ways that we can avoid it. We're going to talk about infection. No doubt, as a transplant patient, as you begin to take all the medications that we're going to be talking about later, you have to deal with the potential of infection. You're going to be susceptible, because you'll be immune suppressed post-transplant. You're going to be susceptible to getting weird things sometimes that you would find out no one else seems to get. Or for that matter, the common illnesses, the colds, the sniffles, the flus, the sinus infections, the old stomach viruses that everyone else seems to get and gets over with in a few days. You may have that, and it may make you deathly ill and put your life in danger. So we're going to talk about dealing with infection and how you can deal with that even though your body internally is immune suppressed. How to fight off infection from the outside to help to protect you. And so we'll mention that in probably an entire episode or 2 or 3. We're going to talk about medication management. I'll probably choose to do my very first episode on that, because post-transplant, if there's anything we need to understand as a transplant patient, it is how to deal with our medications. Generally, a transplant patient, a heart transplant patient particularly, or a lung like I was, a heart patient, they receive about 1,600, I'm going to say that again, about 1,600 pills per month that they're now given to take. And so you've got to know how to manage that. You got to be able to take those medications on time, every time, accurately. You got to be able to identify those medications, be sure the dosage is right, the timing is right, and everything has to be just so, or else There's the danger, by the way, of going into rejection as soon as or quickly as 24 hours after missing a dose. And so we need to get that medication right. And I've got a method that I use to manage my medication that I think is superior to anything the doctors or nurses or coordinators are going to suggest. And it'll keep you taking your medication on time, every time, and in the right way. So I'm going to help you with that a little bit later. We're going to talk about our diets. You know, as you sit down pre-transplant, particularly with the coordinators and the doctors and the dietitians and nutritionists, they're going to tell you you've got to stay away from cheeseburgers and chili dogs and pizzas and chicken and all this stuff, and get away from fatty foods and salty foods and sugary foods. And before you know it, you're going to be stepping away saying, can I even eat? Well, yes, you're going to be able to eat. You're going to need to change your diet quite a bit, most likely, to deal with a transplant after the fact. But you're not probably, like I was, you're not going to be able to do that immediately. You're not going to go from eating cheeseburgers and chili dogs and chips and pizzas to turn around and eating white rice that was boiled and cabbage heads and lettuce and you know, vegetables all the time. You're not going to be able to do that. Quit cold turkey, as we say. So how are you going to manage it? I'm going to give you some tips to make sure that your diet falls into the boundaries of where you need to be, and yet it helps you to have time to grow into a diet that's more adaptable to whatever kind of a diet you need, whether it be a cardiovascular type diet or just a diet that's a regular and general transplant diet. I'll help you with that. So we'll talk about our diets at some point. What about exercise? Most transplant patients, whether heart or lung or not, pre-transplant, their bodies get weakened. Their bodies are very, I don't know the word for it, but basically their bodies are worn down. And so how do they get back from that? How do they get to a place where the doctors want them to be, which is back to being active and exercising and spending time, walking, running, jogging, or maybe even back in the gym, if you've ever even been to a gym. I hadn't, but how do you spend time in exercising? Well, again, like the diet, you're not going to go from a hospital bed, sometimes for weeks and months, to up running marathons. But you've got to be able to find a balance. I'm going to help you find ways to exercise that are not too strenuous, but are going to keep you inside the guidelines or what are needful and required, and just to help you to deal with what's laying before you. What about anxiety and depression? And that's something you may not be aware of as a transplant patient, pre-transplant especially, but all of us as transplant patients eventually deal with some form of anxiety and depression, particularly if you're a transplant patient who receives an organ from a deceased donor, hearts, lungs, that type thing. You've got the ideas in your mind of, why am I alive when someone else had to die? When someone lost their family member, their loved one, why do I get to live? And just back and forth, the emotions can go. So you can deal with anxiety and depression, and we need to face that reality and be able to deal with it. I'm going to give you some tips and tools and some ideas and some thoughts on that and how you can better deal with that. Just in general, how are you going to maintain your mental health as you go forward? That's important, because if you don't have your mental faculties, then you're not going to want to exercise. You're not going to want to eat right. You're going to, deal with some memory loss and such, and you're not going to take your medication right. And of course, if you don't do that, infection, rejection, here they are. They're standing at your door. We've got to be careful as transplant patients. We're going to talk about the entire process. And this has to go forward from post-transplant patients on. What's the process about living day-to-day life? How do you function with a transplant? But I particularly want to back up in that and spend a number of episodes in talking about the pre-transplant process. What would cause someone to become a transplant patient or need to be on a transplant list? What are the criteria for listing various types of transplants, whether your hearts, lungs, livers, kidneys, pancreas, whatever it is? How am I going to become a candidate for a transplant? And what's the process that's used to evaluate me to see if I am a candidate for transplant? We're going to talk about all of that. Again, not from a medical standpoint. I'm not a medical doctor. I've never spent a day in a classroom in the medical field, but I've spent many a day in the classroom of the school of life living as a transplant. And so I can be honest with you. I can tell you, here's the way things really are. Here's the way things here's the way we really have to live, and here's how it feels to live in this way. And I can tell you all about the process, the ins and outs. And so hopefully throughout this, dealing with these topics and so many more, I can help you as a transplant patient, because that's what I want to be. I want to be your transplant helper, to guide you, to take you from the very beginning stages, from the time you get sick and those doctors say those horrifying words. We're going to have to do a transplant, whatever kind it is, on through the process, on as you live out your life. Because here's something you're going to learn, and I'm going to say this over and over throughout these videos and podcasts. A transplant, it doesn't matter what it is, a transplant is not a cure, it's only a treatment. So you've got to learn to live with it, you've got to learn to manage it, and you are your number one manager in your life. Not to take away from your healthcare providers, not to take away from any external source, but if you're going to live with a transplant, friends, you're going to be able to do it because of you, and because of what you do, and because of the way that you live your life. Stay stronger, friends. Until next time, this is the Transplant Helper.